When the patient is fitting, the brain is being deprived of oxygen. The longer this goes on, the worse it will be. Most fits will stop themselves after a few seconds or minutes depending upon the patient. Any fit going on unabated or stopping and starting repeatedly without recovery in between over a 5-minute period or longer should be terminated if possible. One of the drugs we can use is midazolam. This can be given by various routes, however can safely and quickly be given buccally. There are different forms of midazolam coming in different strengths. The dose to terminate a fit is 10 milligrams. In the form we are going to use here, 10 milligrams comes in 2 milliliters. It is not injected, rather squirted into the sulcus to be absorbed quickly through the buccal mucosa. Ideally, when giving this to a patient, wear protective gloves.
You will need the ampoule of midazolam, an oral syringe, a syringe adapter, and a tissue or something similar to prevent the broken glass from cutting your finger. Unless already prescribed for the patient, this should be given by a practitioner who is authorised, either by virtue of being a prescriber or having a patient group direction or other similar authorisation to give this drug. As with all medication, check the drug, the dose and the date. If some of the drug is in the upper part of the ampoule, a tap or ping is usually enough to drop it down to the bottom. Looking at the ampoule, you will see that there is a coloured dot on the head. Below this, on the neck, it has been filed to weaken it, making it easier to break more safely. Better to wrap a tissue around this for safety all the same. Carefully break off the head. You will see that the syringe does not fit into the ampoule, making it very difficult and time-consuming to draw up. So use the adapter, which will fit nicely. Draw up the full amount of the drug. It's now ready to give to the patient. Remember to dispose of sharps safely. When administering, pull the cheek slightly outwards to allow the adapter to insert between the teeth and gums and the inner cheek. Squirt all of the drug into this area and gently massage to spread it and enable it to be more easily absorbed through the cheek lining. The fit should ease over the next few minutes.
Observe the patient until fully recovered or removed to a more definitive care area. Most patients who are known to fit do not require to go to hospital, but need a sleep period afterwards. Ideally, they should be discharged to the care of a competent family member or friend. However, if they have injured themselves or if you believe this to be their first fit, they should go to hospital. Similarly, if you have had to terminate a fit using midazolam, the patient should be transported to hospital by ambulance.